See, told you could do 30.
I was trying to get him over with faster.
I know you got it.
In my head, I'm being a big baby.
I mean, typically you like load this up with how much weight?
Can do so. Yeah. Yeah.
And so no weight. Don't worry about depth.
Don't worry about
rev it
that.
up.
Okay.
Yeah, okay. All right.
2, 1, go.
2022 was my first year competing at the Tactile Games. Day 2 in the morning, the second event, it was this down and back, really short, like sub 1 minute obstacle course. I just landed and my knee kind of caved in and I felt just this intense, weakening, kind of sickening feeling.
You got it, to the end!
It was just a very quick tear, ACL tear. I couldn't even walk to the check-in counter. My knee was throbbing. I couldn't even hide it walking down the aisles of the plane, like just had tears just streaming down my face. That was a really challenging hurdle to overcome.
If it feels comfortable, I want you using that quad not just your head.
Okay. Yeah, then hiking the hip, huh?
That's super common because your quad's weaker, right? And because it's a little bit irritated from the crap.
Uh-huh.
Your body's gonna take the path of least resistance. So if it doesn't have to use the quad, it's not gonna. But we want it to use the quad.
We grew up on a 100-acre horse farm with 3 brothers, and you can imagine, as the youngest, you know, it was kind of a little bit of an underdog story of, you know, just constantly trying to prove myself and be tough. Look at that muscle, look at that. That's actually pretty good, right?
Yeah, it is. Look at that.
Wait, look at that. It's the biggest I've ever seen it. You think it's just because I took the thing off?
Maybe
Same with rebuilding my quad. It's slow, you can't see it overnight. It's not something that's gonna come quickly. You gotta stay in it even on the days that, you know, you don't feel like you're getting anywhere. You just have to trust that it's working. Well, she's pumped.
I think that every jersey that's hanging up, to me, represents somebody's story. They see the players out on the field and the athletes doing their things in the competition, and they don't see all the behind the scenes, all the hours that that person put in to get him back on the field. I am Jeremy Burnham. I'm an orthopedic surgeon. I specialize in sports medicine, and I'm the medical director of sports medicine for Ochsner-Baton Rouge. All right, you guys want to do a timeout?
SED, barefoot, or on, what are we here for?
We're doing a right knee scope, ACL reconstruction with quad tendon autograft.
Get it, girl, come on.
Corinna injured her knee during an obstacle race. During that injury, she tore her ACL. And the ACL is one of the most important ligaments in the knee. It provides stability between the shin bone and the thigh bone. And so when that ligament tears, most of the time it will not heal itself. And most of the time it needs to be treated surgically. Because what we're trying to do is get a partial thickness piece of the quad tendon. We don't want to take the whole quad tendon, and we're trying not to go full thickness if we can, so that the quad muscle and quad tendon is still intact and still works optimally even after we take a little strip of this graft out of there. I walked on the football team at LSU and had the opportunity to play under Coach Nick Saban. But actually in my playing career, I had a knee injury. When you are an athlete and your identity is in competition and that gets taken away in the blink of an eye, that's a feeling that you'll never forget. So this is kind of what it looks like, you know, kind of coming out of the knee. And so we've got a strip, but we've preserved the rest of the quad tendon. And then you'll see Jericho take it to the back table and prepare it and turn it into an ACL. Good. Nice, there's a button. I'll follow you in there if you want me to.
Because I didn't get any meniscus repair done, I could be technically weight bearing right after the surgery. But I learned very quickly that that wasn't going to happen anytime really soon.
Because of the timeline for the ACL healing, though, you also have to know when to pull that motivation back a little bit. Somebody like Corinna, being such a good athlete, such a hard worker, is always going to be pushing those boundaries just a little bit, trying to get back as fast as she can. You need to keep being careful with it, right? So that ACL is still weaker now than it was when we put it in 6 weeks ago.
I can step on this. So this is just all like air just puts in. And just like a little baby jog.
And now you're rocking this one.
Now we're down. If I'm going 5.5 miles an hour, it's only an 11-minute pace.
Yeah.
Really?
6 miles an hour would be 10.
Really? Eh. I'm going
I feel
slow.
like I'm cruising.
I feel like I'm flying. Yeah, no.
Which leg do you want to do first?
What do you think? Should we start differently or?
Up to you. Whatever you feel most comfortable with.
All right. I felt like we had a good thing going last time, so let's
That's true.
still start. But maybe next time we'll try it just to see.
Alright. So with control, you're gonna press out into this as hard as you can, as if your leg is straightening out. It's not actually gonna straighten it out, but go ahead and try.
Okay, ready?
Good.
That was probably low. It felt a little
A
low.
little bit low.
We gotta wake you up. Ready? Still a little weak.
Let's work on some things first.
What was I last time in the?
We got up to about 8.
It's kind of like
So that was about
high 60s. Oh really? shoot.
Okay.
But I think it's important, not to think of it as like that's where it's at. It's just that's today with it being sore is what I have to give. But it's like tomorrow or Thursday, it could be back up to 80.
Yeah. The fact that she's going through this tough time, like, breaks my heart a little bit, but I know that she, out of anyone, can turn this into a positive and come out of this stronger on the other side. How did it feel?
Good.
Is this weekend or next, the technical week?
This weekend.
You're so excited.
I'm so excited. I'm gonna help out, volunteer a little bit, and spectate Taylor's coming, which will be his first one.
I think it'll be beneficial though to like be able to watch a lot and like start to get some ideas of like, okay, what do I need to start working on? How do I train coming up?
Yeah, and like, oh, how comfortable would I feel doing this movement if I had to like do it now, or if I like wanted to do it now? Like,
But the more you can like come back to me with like, okay, this is exactly what I have to be able to do, like, then I know what we need to work on specifically to get you ready and comfortable for those things.
If I were to ask you, someone were to come up to you and be like, what are tactical games? What's the elevator pitch?
I mean, summed up into 2 words, it's firearms and fitness. It was originally created, with veterans in mind. It's a test of not only strength and endurance, but marksmanship. But they also like to keep us on our toes and throw in an 8-mile run.
Go last.
But you're ready to get back out here.
I am excited for when that comes. You're 7 times more likely to re-tear before 9 months, and so I just don't think it's worth it. But it is tempting.
Oh, it's hard to be patient.
Over, through, down.
She came in second at nationals last year, and she's really good. So.
My husband and I met actually at a CrossFit competition, competing against each other in Texas. My husband's been such an important part of my rehab process. In addition to PT, I've been training with him every single day.
We're gonna do this for right now for your warm up, and then when we start doing some other stuff, we're gonna go there. So right now, we're thinking accuracy, and you're thinking technique, and then we're gonna build from speed there. So take your time. Shooter stand by. Threat. Nice. That was awesome.
He's always my rock and the person that I lean on a lot, and I'm super appreciative of him.
Nice, Sal. But see, it's like stuff like this where I'm like, yeah, I'm not ready for it.
No, not a chance. You need another prod bar.
Like.
And so I just feel like that's where I'm at right now. Like, I've got this big competition coming, which I know it is coming. I just don't know when exactly. But I am training for that right now. Everything I'm doing is helping to set myself up for success, whenever that time frame may be where I get to compete.
It's not always going to look this clean, right? But that's going to be the case with everything that we do, right?
The boys hate when I lift with them and then I leave like a 25 and 10 and they can't put a full 45 on. They're like, yeah, it looks so small.
No, honestly, it looks more impressive because there's more weights on there.
No one wants to count all that.
Same form, keep those lats engaged, send through those hips.
I feel like a constant challenge is something that keeps us sharp. It keeps us enjoying life and being more able-bodied and being able to say yes to so many different things.
Perfect.
I think a lot of the mindset that's been instilled in me through adversity and difficult times is 100% attributed to my parents. My dad is a double Olympic gold medalist in equestrian 3-day eventing, won the individual gold medal, but he also won, the team won that year too. They just did a phenomenal job about helping us see the bigger picture. It wasn't about the win or the loss specifically, but it was about how we grew from those experiences and what we could learn from it.
Better control there. Good job.
Yeah.
Yep. So as we're starting to kind of get to that end stage rehab, right, really working on your sport-specific movements, we'll kind of have one focus per day.
And sprinkle in some of the return to sport testing in there. Okay.
For sure. So the first one is a single leg squat with that band resistance for 3 minutes. And this one is by far the hardest mechanically. Halfway done. Keep pushing. 3, 2, 1. Good. I would give you a 52 out of 54, which is a passing score already.
Cool. Okay.
So what that tells me is that endurance is not a huge issue for you.
Gotta restart that one. All right. How are my disparities?
The only big asymmetry that I see, so side-to-side difference, is that anterior reach. So squatting and pushing forward, you were at about a 6 centimeter difference, which we want to get that under 4 centimeters. Yeah, we're officially checking that test off.
So how do you feel about, your confidence in your knee going back to high-level sports activity?
You don't realize, obviously you have these big monumental appointments here, 3 months, 6 months, 9 months, and you don't realize, holy cow, we did so much. It's nice to feel so confident.
I got the strength results, the functional testing back from Emily. Fortunately, you've met all those criteria, so you're officially cleared to return to sports.
I was hoping to get your blessing today.
Yeah. You've done everything that we could possibly ask you to do. You've rehabbed it so hard. You just want to set yourself up for success, stack the deck in your favor. Mm-hmm. And all the data shows that you're ready to go.
Okay, but this is enough PB&Js for tomorrow and Sunday, or should we do a couple more
Let's
for
do
Sunday?
a couple more.
Okay.
And you want to do the hot food, I can do the cold food.
Okay, so you got all of this.
I got all of this, unless
All
you
right.
want to
No, I'll make our dinner.
be over here.
Do you want a bowl for dinner? Wait, October. I don't question my knee at all. Like I don't think about it. Like it hasn't even crossed my mind that like, oh, I have this. Like I used to think about like, oh, my bad leg or my bad knee or my surgery knee, and now it's just like I show up and don't even have a second thought to it. The thing about these double day tactical games events is that like we compete in 4 events each day. So it's a great opportunity, low pressure, low stress to just like come out and do the thing. But now that we're here, I'm kind of like, Mallory, so I know we're trying to have fun and we're going to have fun, but winning is fun.
You cannot take the competition out of her. Like,
just take our freaking time. Especially if we're missing, it's like, what the f am I doing this for? Like every sandbag is an opportunity to have a point.
And 3, 2, 1, go!
Nice. Hi, girl.
okay, let's go.
All the way to the stump. Good job, Mal. Come on. Wow, 1, 2, 4.
1, 2, 4?
Yeah, baby.
I think it was an us thing because everybody else seems to figure it out.
I'm never running with you again.
Are you bleeding? Good job. Girlfriend, you were crushed. You didn't even...
Okay, athletes ready. Here we go. 3, 2, 1, go.
Keep it up. Great work. If I had a patient that was going through now the same thing that you went through, what advice would you give to that athlete?
It's a process, it's a journey. Enjoy every single small triumph that comes along the way. Take one milestone at a time and be proud of yourself for getting there. 3, 2.
Nice work. You got this. You're an inspiration to athletes everywhere, and so I wish you much continued success.
Thank you.
3, 2, 1, time.
I didn't hear you, Dr. Burnham.
Oh my gosh. You didn't hear me? Okay.
That was awesome.
That was a lot more fun.
That was awesome.
So I want to try and challenge you with some one-word answers.
Okay. Oh boy, I'm bad at these.
Competing.
Intensity.
Your injury.
Roller coaster.
Physical therapy.
Hopeful.